now. Again, MED120 medical terminology, and today's date is Monday, August 17. And typically, for those of you trying to catch up, week by week, things are due, but those of you who were registered late, you guys know who you are. We've already communicated with each other. You got until the end of the week to catch up. So what's due for this week for those of us who've been here since week one? It is, let's just go here. It is everything that's week two. So it's everything that is in week two, module two. So what is officially due this evening is, of course, do your quiz, discussion forum, the chapter 5 cardiovascular system, exercises 1, 2, and 3, critical listening, and response exercises 1 and 2. Now, this week is week 3. And what are we doing this week? If we look, we are doing respiratory. And again, as a little commercial, if you got any questions, kindly put it in the chat area, and I'll respond, during natural breaks in the lecture. So let's go to chapter 4, and I figured out the problem with why I can't access my textbook is because I'm on, some of you may be on a Mac, and for whatever reason, it doesn't work on Safari. I tried all these settings. So you just easily download it to Firefox, put the link in, and it should work. It should work, in theory. Maybe not in theory. Let me look at this ebook again. Copy the link. If not, I got to sign in into here. Yep, I'll just sign in here. That's one way to do it. Online.stratford.edu. And then I get in. And then I find MED120. So respiratory. So ORI, again, one of the many pertaining tos. And if you look at the week 1 notes that were in announcements, you'll see maybe on like the 3rd or 4th page, there is a, there's a whole list of all of the suffixes that deal with adjectives, meaning something that's describing something, or in our case, in the word respiratory, ORI, pertaining to. So if it's a pertaining to, that means it's an adjective, and it should precede some sort of noun. So I can't say stuff like, my patient has a respiratory. That doesn't make any sense. That's like saying my patient was wearing a green. A green what? A green hat. Or you could say my patient has a respiratory problem, or my patient has a respiratory case, or a respiratory therapist. So now if I go this way, I go here, and I go into my textbook. Yay, it should work. Okay, so those of you who, again, your textbook, there's exercises in the textbook. You're not really responsible for them, but it's nice to try them out. But remember, your the system here, your textbook doesn't save it. So if you want to save it for future reference, either make a video, or you can, what do you call that? You can screenshot your answers, so you can retest yourself. And remember, in a couple of weeks, we're going to have our midterm. Those of you who haven't emailed me yet, please email me to confirm that you're either coming on ground or online. And remember, if I do not have a reservation for on the ground, you cannot be allowed on campus, because we have this class is, I believe, 11 or 12 people. I can't have more than 5 people in a room. So I need to know how many coming in. So if you haven't done so yet to reserve your spot for your midterm exam in about 2 weeks or so, please do so. And the dates for midterms and finals for this particular class is there in your announcements. So I click here on the respiratory chapter, and if you look at the textbook, it always starts off the same way. It always starts off with who are the people in your neighborhood. So respiratory medicine, also known as pulmonology, logi, study of a pulmon or your lungs, right? They are subspecialists. Typically, you do 4 years in internal medicine, and then you do 2 to 3 years in pulmo, and then complete your fellowship, which could be another year or a year or two, and then you can be called yourself a pulmonologist, and then you take your board exam and whatnot. So these individuals are experts at anything that deals with the lungs. And they're not limited to, but they're really good at asthma, emphysema, chronic bronchitis. Now, if you look at this word chronic, let's break down, let's have that as a nice little reminder. Something that's chronic is, ic is pertaining to, so it means it's an adjective. Pertaining to, chronos means time. Now, that means my patient who has chronic bronchitis, the tubes in their lungs, bronch, has inflammation or infection, and it's months, weeks to months, at least 6 weeks is the cutoff for chronic bronchitis. And something could be also acute, which means this happened quite quickly and relatively, like overnight. Something that overnight or over the weekend, it happened very quickly. So if my patient has acute bronchitis, that means symptoms and all their troubles started a couple of days ago, or yesterday, or a couple of hours ago. But somebody who has chronic bronchitis, they've had this for a while now. And if you have chronic bronchitis, that's part of your COPD, which is chronic obstructive pulmonary disease. And the two diseases that fall under it is chronic bronchitis and emphysema. Okay. So those are the people in your neighborhood. And the main function of the pulmonary system is respiration. And what respiration really means is gas exchange. You suck in, right, for lack of a better term, oxygen, which is fuel. You need it, right? And the byproduct of using up that fuel, because all machines, the human machine itself, is also a machine that has an exhaust. So what must come out is carbon dioxide. And you have the upper respiratory tract, which is everything above this tube right here, which is your trachea. Everything above your trachea, that's upper respiratory. So if you have an infection up here, like your nose, rhinitis, or maybe you got some sore throat, pharyngitis, and then maybe you have a little bit of infection in your voice box, right? That's laryngitis. Your voice box is your larynx. So those are all upper respiratory tract infections. And they're not that serious. But the lower respiratory tract infections, anything that will affect your lungs or your trachea or your bronchus is serious. These are the things that you end up in the hospital for. So pneumonia, bronchitis, emphysema, and a whole bunch of things. Now, at the end of, oops, got a question. Pick the time. No, the time is already set, but if there is already set for week 5, that Monday, 6 p.m. on the 6 p.m. at the campus. And if you are not on campus, you have to check into Zoom, and your exam will be from like 6:05 to 7:05. But I'm gonna have a nice little thing out on announcements for clarification, because that's for next week. And this is really week 3 already. Next week will be week 4, and then week 5 will be upon us. And by next week, I'm gonna also, if you also looked at announcements, I put a mock quiz on what my quizzes look like. I'm actually gonna put a previous midterm. I'm not gonna give you the answers, you go get the answers, but just to show you how my midterm looks like. All right. So I'll have that out by next week. Now, if you look at the ends, you have your right bronchus and then your left bronchus. So those are the main tubes. And at the end of these main tubes, you have these bunches of grapes. These bunches of grapes, plural, they're called alveoli. And if you see the word bronchiole, remember, if you have the suffix ole, that means the tube gets really small. So you have the right main stem bronchus, left main stem bronchus, and then it goes little branches, little branches, little branches, until it gets to the level of the bronchioles. Now, it is at this level where there's gas exchange, where oxygen has to go in and carbon dioxide has to, of course, go into your lungs and then out when you exhale. And that is called gas exchange or respiration. And it happens here at the level of the alveoli. And now you can see why a lower respiratory tract infection is way more dangerous than an upper respiratory tract infection. Upper respiratory tract, rhinitis, if you got a really stuffy nose, are you going to die? No. Sore throat, are you going to die? No. Laryngitis, are you going to die? No. But you have tracheitis, you have any damage to your trachea, the only tube going in and out into your lungs, if you have bronchitis, if you have pneumonia, right? If you have anything that are affecting down here, what's it going to directly affect? It's going to directly affect your, and of course, asthma, which is an exaggerated immune response, right? Anything that will affect this level, all into your lungs, that's dangerous. That's why I kind of scoff at people, well, before, back in the day when students used to give me notes like, oh, I'm not going to be in class because I have an upper respiratory tract infection. I scoff at it. So what? You're not going to die, right? You're going to feel like you're going to die sometimes because if all of this gets stuffed up, we all know you feel miserable, but the odds of you dying, not so good. But down here, if it's a lower respiratory tract infection, especially if it's a chronic disease, it's something that you should take care of. All right, let's jump right into the words. So of course we have our word elements, and remember your combining form. It's the root, slash, and with an O. And the O is the combining vowel. So that's what a combining form is. Doesn't that look like a beautiful both A and B question? What is a combining form? Is it A, root, B, combining vowel, C, both A and B, or D, none of the above? Okay. Another thing I'll be doing like around week 4, at the beginning of the week 4 lecture, I'll be, or maybe I'll just produce a video of it, how to deal with a multiple choice examination. And also, if you've never been trained or never been taught on how to use, how to get by a multiple choice examination and how to actually break it down, please Google it, look it up, or give me a call, shoot for tutoring. So let's look at this adenoid. First of all, let's break down the word adenoid before we can get into the word adenoidectomy. So adeno, that means gland. Oid is a suffix that means resembling. So if something was an adenoid, it's something that's resembling a gland. It looks like a gland, but it isn't a gland. How about if I had something that was lipoid? It's resembling some substance or something that looks like what? Resembling lipid or fat, also known as adipose tissue. What's another one? Mucoid. That means the tissue looks like or resembles mucus. Dermoid resembles skin. I could have a dermoid tumor. Looks like skin, but it isn't. It's a tumor. It's something else. Like a dermoid cyst, that isn't skin. It's something else. So oid means resembling. And an adenoid is something that looks like a gland, but it isn't really a gland. Your adenoids are actually part of your immune system and a part of your tonsils. And you could go through that in your anatomy and physiology. So an adenoidectomy, and if you recall ectomy from the notes, remember what do we do with our X's, right? If I excise something, what am I doing? X means what? Out. What do you do with your ex? You kick them out, I hope.
Removing.
Remove them. Kick them out. Now, if I had a TOMI, what am I doing? I'm only what? Cutting into, right? So a laparotomy, am I taking anything out of my stomach? Nope. I'm just cutting into it to see what's going on. But an adenoidectomy, what am I doing with the adenoids? They're either infected beyond repair, so I have to then remove them. I mentioned larynx and pharynx earlier. Larynx is your voice box, and I could scope it with an instrument. I could perform laryngoscopy. So remember the difference between scope and scopy. It's on my notes. I've mentioned it in 2 lectures. So what does that scream? It screams that, oh, this has to be on the midterm. So there's got to be a scope versus scopy question somewhere. Nose, nasal. Remember I told you about both A and B questions, which medical is rife with both A and B questions. Could there be a question like, between all of these words, nasal and rhinorrhea, which of the following which of the following has a root regarding nose? Is it nasal, rhinorrhea, both, or neither? And and those kind of questions are called K questions. Everyone hates those questions. But if you know how to handle them and know how to do the process of elimination, they're not as bad as they seem. And again, like I mentioned day 1, if you're a bad test taker, it simply means you are a bad preparer. You didn't actually practice and take quizzes and take bits and pieces of the exam prior to the exam. Like the analogy that I stated, a prize fighter doesn't go into a fight without actually getting into the ring. I know for a fact, because when you train for a fight, you at least do 6 rounds a day, at least, in an actual ring with an actual person. Now, let's make that analogy compared to what you guys do. When you guys study, do you actually quiz yourself? Did you actually practice? And if you look at the textbook, we're going to show it to you in a minute, that's actually how it's set up. So a nasal passage or nasal cavity, that's got to be upper respiratory tract infection because it's got to deal with my nose. Rhinitis, inflammation or infection of my nose. Rhinorrhea, that's just a fancy word for postnasal drip. But if you have excessive rhinorrhea, so not everything that comes out of your nose is clear and doesn't smell, right? It could be cerebrospinal fluid. Hey, it's a rarity, but I've seen it happen. But again, there's ways to know that as well in the history. Pharynx, of course, means your throat. Larynx is your voice box. So is there such thing as a pharyngoscope? Yes. Is there such thing as pharyngoscopy? Yes. Is there such thing as pharyngitis? Yes. Laryngitis? Yes. Now, between the two, which one would you lose your voice? If you have pharyngitis, you're going to have a really bad sore throat, but your voice should be intact. But if you have laryngitis, true laryngitis, how's your voice? Can you talk? No, you don't. It'll be hoarse and it'll not only be painful, but you'll be talking like this. Nothing will be coming out. Your tonsils, again, your tonsils are also part and parcel of your immune system. They are those, why am I just saying it? Let me just show you. Why am I being stingy with pictures? And can I bring this down? This is annoying. I like this down here. So let's look at what a tonsil is. Hello, what does that mean? If you look at your, what is a good, here you go. If you look at your mouth in here, like some people think like this is your tonsil. This is your uvula. This is the rudder that kind of directs the food to go down your throat. Okay, that's what the function of this punching bag here for. But here on the sides, and you'll see it has a very glandular-like structure. So it looks like it's an adenoid type structure. Those are your tonsils. And you have to have your own set of immune tissue in your mouth because your mouth is a dirtier place than your butt. There's 200 plus things in there that could cause you a whole bunch of trouble. So it's good having lymphoid or immunologic tissue in there to help fight whatever nastiness is going around in there. Okay? And then you could use your medical terminology powers to know what things are. So posterior and anterior facial pillars, they're what? There's one in the front, one in the back. Buccinator is a muscle, right? Buccal cavity means your cheek. This, between your tongue and cheek, this area here. So that looks like the word buccal. So that's your cheek. So if you have buccal meds, that's where you put them. You put them in here. And of course, underneath your tongue, right? This is your gums and stuff. But if you lifted up your tongue here, underneath that, that would be sublingual area. And that's where you put sublingual meds. So that's your tonsils. And that's the thing that can get really inflamed, especially in a peritonsillar or a severe oral infection, or if you're immunocompromised as well. So peritonsillar area, all that area, it gets, when in infection, first it gets yellow and pussy, then it gets red, then it hurts, and then you're gonna have some dysphagia. Let's look at that word real quick. You're gonna have a hard time swallowing things. Ia, state or condition. This is the prefix of abnormal or away from the rule, and swallowing. The rule is when I swallow, it should go down all right. But if it goes down hard and if it hurts, right, that's not fun. Your trachea is your windpipe. And if I'm going to do a tracheostomy, and we're going to see a picture later, I'm going to form a hole goes in your mouth. And we do that, and it makes sense if you look at here. We already know that the trachea is the only airway that goes from your upper respiratory cavities here, and there's only one way down here. So what happens if anything, if this got crushed, or in the case I had a truck driver when I was in EMS, his teeth got all bashed in on the dashboard of his car when his truck hit another truck, and all these teeth fell into here, and this jawline was all busted up, and then this got closed. So we had to create a stoma or a hole in here, and that's called a tracheostomy. And in order to cut into that trachea right here, we had to perform a tracheotomy, to cut into. Now, did I take out the trachea? No. Tracheotomy, I cut into it so I can form an opening or a mouth, and that's called a tracheostomy. Stoma means mouth. Okay, let's look at the some words representing, or some combining forms representing the lower respiratory tract. We already looked at the alveoli, that's plural, right? Alveolus is singular. So any alveolar pathology would be a lower respiratory tract infection, or an LRTI. Bronchus, we talked about bronchitis, inflammation or infection of the main stem bronchus. Bronchioles are the very, very small tubes. Now, bronchiectasis. Bronchiectasis is the dilatation of the bronchus or bronchi. And remember, your body likes being in the middle. It doesn't like bronchitis when everything's all tightened up and small. It also doesn't like bronchiectasis either. And you'll learn in anatomy and physiology why bronchiectasis is just as bad as bronchitis. We could scope it to see what's going on. The machine itself is called the Bronchus Scope, and I'm going to order and schedule a bronchoscopy. Remember, scopy with the Y, that is the procedure. Scope is the actual instrument. Bronchiolitis, bronchitis, same thing, but this is affecting the smaller tubes. Now, your lungs have this covering called your pleura. So if you have pleuritis, you can have inflammation, infection of the outer covering of your lungs, and you will get something called a pleuritic rub. Ick or itic pertaining to what? The covering of my lungs. And if my lung coverings are infected, how much quicker will my lung be infected? It's going to get infected pretty darn soon if it doesn't get infected already. and a pleuritic rub or pleurisy. Let me write that down because that word is also common in, that's when there's inflammation or infection of your pleura and you get what they call a pleuritic rub. Have you ever had like a really bad cough and every time you cough, it felt like there was a knife in your breastbone? That's what pleurisy is, and that's what a pleuritic rub is. It's painful, and that's a sign that, hey, your pleura is most likely infected, and now it's rubbing, and now it's causing irritation, and that's not a good thing. Pneumo means lung or air, so pneumectomy is an excision of either part or all of the lung, and you can take out both lungs and replace them. Um, remember ectomy? I don't know what else I could say about that. Ectomy just means removal. So a pneumonectomy, that means, or pneumectomy, either way, pneumon or a pneumonectomy, I've seen it, pneumectomy, either way, it's removal of the lung. Pneumonia, now, pneumonia is an inflammation or infection of the lungs, and it could be one side or other side. It could be caused by a bacteria, a virus, chemical. It could be caused by anything. But pneumonia is when there starts having a fluid buildup in your lungs. Now, remember what I just said a minute ago, that your body only likes being in the middle, right? So your lungs can't be too wet, nor can they be too dry. They have to be in the middle. But pneumonia is a case where they're very wet, and when they're very wet, it gets hard for the alveoli. You know those bunches of grapes at the end of the bronchus. It gets very hard for the oxygen and carbon dioxide to pass through water, and then that's why you start coughing and having all those um, problems. And this pneumonia is the biggest thing that people would die of COVID of, right? Is because COVID is a virus, and COVID-19 loves pulmonary tissue and causes an intractable pneumonia. And since we don't have an antiviral medication specific to COVID, it's a good way to die. Actually, this is also a very common way to die from full-blown AIDS. You'll probably have something called PCP if you were HIV positive going into full-blown AIDS. PCP stands for pneumocystis. Well, that should be a capital P. Carini pneumonia. It's a hard way to die. You will be essentially drowning in your lung tissue. And you see, what did I do with the pneumocystis carini, also known as P. carini? It is a type of bacteria that is very, very common in HIV infection and full-blown AIDS. It's very intractable, and it doesn't respond very well to any antibiotics or antivirals. And it's usually end stage of the disease, and it's not fun whatsoever. It's a really, really hard way to die. Of course, pulmonology, pulmonologists. I'm a ray of sunshine today. Jeez. Thoracopathy. Now, your thorax is where the area of where your lungs and where your heart is, right? It's essentially your chest cavity. So even though we're learning these things separate, heart and lungs, heart's in one chapter and the lungs are in the other, thorax, your heart and lungs are cousins. When one stops, the other one stops. That's why CPR is very, very important. And the golden 5 minutes of CPR is very important, because either the lungs or the heart stops. You have 5 minutes to try to get oxygen through that system again, or the patient will have irreversible brain damage. So thoracopathies are very serious to us, and we get, in the clinical world, we get a little bit excited. So let's look at these common suffixes, or suffixes. Suffixes, that's a way to pronounce it. They're also in my notes that I posted week 1, but let's go through some of these. Algia means pain. So remember that pleuritic rub I was talking about? You could be experiencing pleuralgia if you had a really bad lower respiratory tract infection accompanied by a hacking or a hard cough. Thoracodynia, that's another way of saying pain in the chest. But it's like, but again, these terms, it could be thoracodynia, could be, the pain could be from your heart, the pain could be from your lungs. It's a generalized term. But pleuralgia is specifically for the pleura, the covering of your lungs. Ectasis, we already talked about that, dilatation or expansion. Now, atelectasis is a sign of emphysema. It is when your alveoli, remember I talked about bronchitis, where your alveoli will start squeezing because it's an itis? Well, in emphysema, for chronic smokers, the alveoli get really, really big. And then when they get really, really big, they fall apart and then they collapse. And they cause pressure problems, which causes signs and symptoms of why an emphysema patient has a hard time breathing. Now we have a question in the chat. Now, cardiac tamponade. Let's spell that for you. Now, just like what's a hoses? Just like pleurisy, you can have an inflammation or infection of your heart because your heart also has a covering. If you recall the last week's lecture, or at least the video from last week's lecture, I talked about the pericardium. It's the sac that's surrounding the heart. Now, if the pericardium gets filled with blood or pus or for whatever reason, and let me remember my last case because I always like talking about cases because it helps me it helps me remember things. So my last pericardial tamponade patient, again, another driver, she was driving pretty fast and then she wrapped her car around a telephone pole or something like that, or hit a retaining wall, something to that matter. But whatever happened was, even with her seatbelt on, she she caved in her chest, and it broke like 8 ribs and her sternum, her breastbone, and it caused massive bruising of her pericardium. And then the pericardium started filling up with blood. Now, if the pericardium, the sac that's covering the heart, starts filling up with blood, what do you think it's going to do to that poor heart? It's going to start squeezing on it. And when it squeezes on it, can the heart do its job by pumping out blood? No, it won't. So your blood pressure will bottom out. You'll also have distended neck veins. Your patient's face will start turning blue, and they'll also have cardiorespiratory emergency signs and symptoms. Pericardial tamponade is crazy serious, and the way we deal with it is I stick a needle in your heart, ultrasound guided, of course. Back in my day, we used to just do it by feel, and you just drain out the blood, and the symptoms should get better. So that's pericardial tamponade. Now with the lungs, it's like a bigger thing, so it's harder for the lungs to get squished by any pleurisy, but it still hurts just the same. Where were we? Osis. We already know that osis, and related to pericardial tamponade, my patient will have cyanosis, but only from the neck on up. And that's because the pericardium is squeezing on the heart. The heart won't be able to give out oxygen, so what's going to happen? Your head will start turning a little bit blue. And if you're a person of color, you're going to look more ashen. Not necessarily a blue color. You'll look ashy. Like your face will start looking gray. And another way to also look to see if there's cyanosis in a person of color is you look at the inside of their lip, or you pull down their eyelid. If you look at the inside of your lip or you pull down your eyelid, no matter how the color of your skin, it should be pink, and you should see a lot of blood vessels. And if my patient's cyanotic, you won't see that. You'll see like a bluish discoloration. It'll look palish, and that's called cyanosis, okay? And that is osis. Definitely abnormal. Definitely it's a problem. And remember, the word abnormal means pertaining to, away from the rule. The rule is, should I look ashy? No, I should look what? A full of color. Even a Caucasian person should look like they have some color in them. but cyanosis, it'll look like their blood's draining. Anosmia. An is the prefix meaning no, ia, state or condition. Osm means to smell. So anosmia means your patient can't smell. Either is because they have postnasal drip or, they have some sort of blockage in their nose. But anosmia, a lot of times, it's a neurologic indicator. Usually means that there's a nerve problem somewhere. Aphasia, we already talked about. Oxia. Let's look at hypoxia versus hyperoxia. Let's look at the oxias. So I could have hypoxia, state or condition of decreased oxygen, okay? And your pulse oximeter should be reading less than 97%, right? So that's a state of hypoxia. Now, could my patient have too much? Yeah, in theory, right? Could my patient have absolutely no oxygen? And that's called anoxia, okay? And that's never good. And again, if my patient's receiving too much oxygen, that's not a good thing either. It dries out the mucosal lining, causes a whole bunch of problems. It's usually when someone who's not paying attention, well, no, let me not get into that because that's a clinical thing. So hypoxia, hyperoxia, anoxia. Ooh, doesn't that look like a nice exam question? Hey, look at that. Look what I can do. Can you test yourself at home and do this and make your own quizzes? Or look at the quizzes in your patient has a decreased decreased oxygen of 95%, where 97 to 100% is normal. Does my patient have hypoxia, hyperoxia, or anoxia? It's hypo, decreased, right? My patient is not breathing at all. There is absolutely no oxygen going in or out of her lungs. That's anoxia, right? My patient was given way too much oxygen. Some genius put her nasal cannula at 5 liters. Way too much. Then it's what? Hyperoxia. And again, you could make up your own quizzes, but you can also look up your textbook and or shoot me an email. I used to give when we were on the ground. I used to give quizzes every week, but now that we're like hybrid online, you guys got those quizzes, so you can try those out as well. Aerophagia usually happens with babies, right? And then they get really gassy and their stomach gets distended as well. This also happens post, what do you call that? Post-operatively, your patient is sucking in way too much air, and then they have stomach distension. It's unpleasant. Let's look at apnea, just like the anoxia. A means no or not, nia means breathing. So let's look at this. Can I expand that? Sure. Right? A goes ania or apnea, right? Which of the following my patient is not breathing at all? Apnea. Which of the following my patient is breathing too much? Hypernia. Which is my patient is breathing but breathing in decreased level? Hyponia. Right? You could do this all day, and you could take every single word that we do and preempt me and figure out what are all the possible ways you can ask a word. And we already had dysphagia, we had aerophagia, right? And let me add one more to the mix. How about if I had this? Dysphagia, aerophagia, and polyphagia. D, none of the above. Which of the following my patient is having difficulty swallowing? That's the first one. This, abnormal. Which is the one my patient is swallowing way too much air? Aerophagia. Which is the one where my patient is eating way too much? or swallowing way too much. Polyphagia. And polyphagia is when usually describes diabetics, because diabetics usually feel that there's nothing in their gas tank, so they're constantly eating, and which adds to the problem. And as a pre-diabetic and a person who hasn't had dinner yet, yes, I'm feeling it. Pharyngospasm, laryngospasm, anything that has muscles in it can have a spasm. And there's muscles or involuntary contractions of muscles all over your body at any given time. But if they're increased, that's not a good thing, especially if it's in your larynx, your voice box, or your pharynx. That's your throat. Thorax, we already went through. That means your chest. And if you have an accumulation of pus, that's pyothorax. And just real quick, what is pus? Pus is essentially dead white blood cells plus dead pathogens, which could be either a bacteria, virus, or fungus, or foreign body. So now you could see, this is the analogy that I put it. When your white blood cells and your pathogens are things that will cause you harm, right? Things that will make you sick. Gen, something that creation of disease, because patho is disease, the Department of Pathology. You could do this all day and just keep on. That's a study of disease. So all of these are pathogens. Bacteria, virus, fungus, foreign body. And they could go to war with your white blood cells. But what happens in a war? Someone's got to die. So on both sides. So there's a whole bunch of dead white blood cells and dead pathogens. Now, the problem with dead things in your body is they release chemicals that tells your living cells, hey, maybe you should go die. And that's called TNF, tumor necrosis factor. Now, what does tumor mean? Tumor is just simply lump or bump. But necrosis, abnormal condition of death. Necker means death. So when you have a whole bunch of pus, it's going to release this TNF, and it's going to tell your whole entire, all the good cells, good healthy cells around it that, hey, we're all about to die, so we should all just lay down and die now. And that's not good, and that's called necrosis. And that's the reason why if you have any wound, we clean it very, very well. And if there's any pus, we lance the pus and we empty it all out. And if you're into that Dr. Pimple Popper thing, more power to you, but I think it's nasty. And actually, a lot of people don't like doing that part of their job in outpatient department. I never thought in a million years Dr. Pimple Popper would be so popular. If that was the case, I should have left internal medicine and just did dermatology all day, or basic surgery, either way. So if we look at here, you could see here where you could you could test yourself. But remember, when you put your answers here, like when you submit them, when you put the answers here, and you click on it, all of this stuff goes away. So let's look at this example. Now, what I would do is I would take some of these and maybe copy and paste them, or, you learn them and then you do what, right? You make your own quizzes and then you copy and paste them, put them all together. Guess what? You're gonna have an exam and a practice exam. So if we look at the word nasogastric, right? It's a feeding tube, right? So where does it have to go? Nasal, that's my nose. Gaster means stomach. Ick, pertaining to, so it means pertaining to my nose and stomach, right? And pharynx, of course, you can make a question, pharynx versus larynx questions, and that's really nice. The combining forms for nose, right? We already know nasal, we already know rhinal, but what are these other ones? I don't know. Let's check. Oh, nasal, rhino. Okay, right. Para, here's one we didn't talk about. Well, we'll talk about it more when we talk about the nervous system, but para means to be alongside something. So if something's paramilitary, it is a group of individuals that run alongside the military. So if I have a paranasal sinus, that means it's a bunch of holes or a bunch of rooms in my skull that are alongside of my nose. So if something's paranasal, so you can go all the way down and try those. And oh, looky here, you have your sinuses. You have your maxillary and you have your paranasal here, right, and here. And here's your frontal sinus, al, pertaining to what? The front. And what are these sinuses? They're just holes in your head, in your skull. You don't notice them until they get filled up with fluid when you have sinusitis. And that's when your head feels like a cinder block. And your head is a very, very delicate thing. It's not only strong, but it's delicate and it's very sensitive. For those of you who had long hair, ever cut your hair, you feel like your head is bobbling around, 10 pounds lighter. It's not that it's 10 pounds lighter. It's just that it's very sensitive to changes. And when you see these sinuses, those of us who suffer with sinusitis during the allergy season, um, there's not a lot of space. But when they start filling up, oh, gives a nice headache and nice nasal pain. Pharynx, larynx. Oh, these are beautiful pictures for anatomy and physiology for future use. Upper respiratory, lower respiratory, trachea, right bronchus, left bronchus. Then you have your alveoli. This is a single alveolus. Remember, the carbon dioxide has to go into the lungs so it can go out, and the oxygen goes into the body because the oxygen is fuel and the carbon dioxide is the exhaust. It's the thing you got to get rid of. I just came back from the gym. I just love people who don't breathe in the gym. Crack me up. For Ringo Stenosis, we already learned stenosis means the tube is getting smaller and smaller. And that this happens in premature babies or babies who have malformation of their throat and their trachea. It's relatively common. It's when the baby throws up both, well, not solid yet because they're infants, but they throw up their milk commonly. I had a friend of mine, his daughter had that. Voice box, and you could see it's all wash and rinse and repeat, and it's all the words that you saw before. Well, here's the picture that I was talking about. Here's your stoma, right? She probably had, I don't know, throat cancer or something going on there. So we had to cut into all of this, right? So she can't breathe through here because we got to do surgery and whatnot, but she still needs oxygen in her lungs. So we create a we perform a tracheostomy. I cut into here, which is called a tracheotomy, and then we put in the stoma, and then we connect it either through mechanical ventilator if we're doing surgery, or her oxygen tank and whatnot, or she could easily breathe clearly through that as well. Now, do you see this expanding balloon? That's how we kind of keep it in place, and we pump this balloon up with a syringe so it doesn't move around too much. Let's see. And pneumonectomy or pneumectomy, either one, potato. It's when I either move a part or full lung, and you could also have bilateral, meaning two. Let's look at that word I just used, bilateral. Later means side, so pertaining to side. So if I have a bilateral pertaining to both sides. If I had a unilateral pathology pertaining to one side, and you better define which side. It is my pet peeve. I always get stuck. I always read reports like patient had a unilateral mass. Okay, is it left or right? I need to know, right? So lateral, right? Those of you football fans, NCAA has to wait until next spring, but Lateral is when you pitch the, you pitch the football to the side and it doesn't break the line of scrimmage. No, no one's into football. Okay, it's a little bit un-American of y'all, but that's all right. Carbon dioxide, we already talked about that. Oh, these are the abbreviations of oxygen and carbon dioxide. So O2, because oxygen, that's how it exists chemically, and CO2, carbon dioxide. Remember, carbon dioxide is your exhaust, oxygen is your fuel. Why did that take me more than a second to remember? That is not good. Oh, let's look at here. Let's look at some of these prefixes. And I have some of them. We already went through dis. Let's look through brady and tachy. And this one called u, right? And how do you remember it? Okay. So let's look at breathing. Remember we went to hyper? So tachypnea, or tachy, and then nia means breathing too fast. And typically, clinically, it's greater than 20 breaths per minute. Now, bradypnea, breathing too slow, less than 14, why is this bold, breaths per minute. Now, of course, this medical terminology, you don't have to memorize these things, but eunia is normal breathing. So it's within 14 to 20 breaths per minute. Now, can I do this also with the heart, tachycardia, bradycardia, eucardia, normal cardia? Yeah. And of course, tachycardia greater than 100 beats per minute, bradycardia less than 40, and, or is it 12 to 20? I think it's 12. You guys can look it up. Okay, and tachycardia greater than 100, less than 40, eucardia between 40 and 100, normal cardiac 40 to 100. So eucardia and normal cardia is the same thing. Oops, let me spell this correctly. Okay, so that's how these go. Tachycardia, U, and of course, brady, and we already went through A, means no or not, or without. Okay, let's see what else other gems we could find. Ooh, CPAP machine. CPAP stands for continuous positive airway pressure. So these patients, since they have some sort of blockage, usually either, if it's a nasal blockage, we can do surgery on that, or if it's a deviated septum. A septum is a thing that separates anything into a left and a right, and you have a left nostril and a right nostril, and this one has a pharyngeal at the level of his tonsils, and it's causing sleep apnea. And these are the people who they snore really loud, and it's called the spouse test. If the person you're sitting next to wakes up because of your snoring, yeah, go see somebody. Okay, it's not supposed to be that loud. Now, one way we can correct it, especially in younger people, is, or even older people, even post-surgically, we use the CPAP machine. Now, what's sleep apnea? A, no or not nia breathing. So because of the obstruction, not enough oxygen is getting to where it needs to go. That's why these patients, they don't sleep very well. And then when they wake up all sore and tired. And that's not good because sleep is really important. Do you remember when we were kids, like, I don't want to take a nap. Now as an adult, I want to take a nap, right? Heck, I'm ready for a nap right now. Ooh, look at here. Pleural effusion, right? Do you see the 2 layers of your pleura and it got infected with a whole bunch of pus and stuff? So what do I got to do? I got to perform a thoracentesis. Thorax is my chest area. Thoracentesis is a surgical puncture. So this is considered minor surgery, and we got to glove up, we got to mask up, and then we have to prep our patient, and this is bad news when this much pleural effusion. This that's when all of this, and it's in between the lung and the two layers of your pleura or covering of your lung. It's not the same thing as pneumonia, but it will have similar signs and symptoms, and it's just not good. Freno, not as common, means your diaphragm. Your diaphragm is the thin strap muscle that helps you breathe. It's in between your stomach. Oh, here it is. It's in between your abdominal cavity and your thoracic cavity. And that's the thing that creates that negative pressure so you can breathe. You'll learn all about that in anatomy and physiology. Muco versus myco. Remember, muco means mucus. Myco means fungus. So mycology is the study of fungi, plural. Got a question? Thoracentesis. What's the same? What do you mean? What is the same as thoracentesis? This thing? This is thoracentesis. This is when I'm going to try to remove something out of your thorax, and in this particular case, it was pleural effusion, right? But in a way, thoracentesis is what we do for pericardial tamponade as well, but it's pericardial thoracentesis. But everyone knows if you have a cardiac problem and I'm doing thoracentesis, that means I'm alleviating fluid from the pericardium. And if I have a pleural effusion as a diagnosis, that means I'm performing thoracentesis on that particular affected lung. And I've had times where it's both lungs. I've had bad news when it's bilateral. And that's never a good sign. Let's move on down. I'm getting close to time. I'm wrapping it up, gang. Let's wrap this up. Ooh, look at here. Remember I mentioned COPD, chronic obstructive pulmonary disease? There are two types, emphysema and asthma. They are both very chronic problems. And if you see an asthma, right, which is just like bronchitis, right, everything's going to be what? Squeezing, and it's going to close, and it's going to make all of these things stenotic. So you're going to have constriction of the smooth muscles because it's going to be a reaction of your lungs, because asthma and chronic bronchitis have similar problems, right? But the asthma is due to an exaggerated inflammation response, but the chronic bronchitis is due to some disease state, some pathology, some pathogen, like most likely a bacterial or a fungal. Now, emphysema, you could see here what's happening in emphysema. You still can't breathe very well because, remember, your body likes to be in the middle. It doesn't like to be all constricted like here. Your body doesn't like when everything all puffs up like this, because now the carbon dioxide and oxygen can't easily go in and out through these things because they're all puffed up. And that's emphysema, and that's classic chronic smoker or someone who has been exposed to a lot of foreign body like asbestos. But odds are 9 times out of 10, it's always smoking. And by the way, smoking is one of those things that if you're on an oncopathology exam and they ask, hey, what was the cause of this cancer? If you answer smoking, it's almost always yes. Now, we went through all of these, most of them. Let me go over the ones that we didn't go over, like ABG, arterial blood gas. You'll be going over that in anatomy and physiology, and also again in your pathology classes. Cystic fibrosis. It's a bunch of forms, a bunch of infection of cysts, and we already know what cyst and pus are, and osis, abnormal condition of fibers in my lungs. So you got a lot of pus and mucus and cysts and a lot of fibers. That's not a good combination in your lungs. CA usually means carcinoma or cancer. I never seen it for cardiac arrest or chronological age. I've seen it for cancer or carcinoma. ARDS is acute respiratory distress syndrome, right? So when did that happen to my patient? Where they had a lower respiratory tract problem, and it was serious enough to cause enough distress, enough breathing problems for the patient to be admitted to the hospital, and that's acute. Happened very quickly, and that's ARDS. CPAP, CT is computerized tomography. It's a machine that takes multiple like slices, like X-ray slices of you, and then the computer puts together like some sort of 3D model. It's pretty neat. DPT, diphtheria, nice to know. Diagnosis, you definitely need to know. Now, I'm wondering, did I go over the word diagnosis versus, oh, spinal tap is very, very different. Spinal tap is, well, hold that question until when we get to neurology and the obstetrics. It's very, very different than thoracentesis. And remember, your spine is where? It's not in the front, it's not up top, it's in the back. And the part of the spine that we do the tap is what? Lumbar 4, lumbar 5, it's like the bottom of your back. Let's look at the word diagnosis versus prognosis. And if I went over it before, that's okay. I'm going to go over it again. Remember, diagnosis, state of condition of complete or thorough knowledge. And prognosis, state of condition of before knowledge. So you get a diagnosis. That means I took all the histories that I could take. I took all the laboratories. I talked to everybody who I have to talk to. And this is the thing that we all found out. This is the summary of all those tests, of all those histories. That's your diagnosis. And that's the reason why I can't tell you until all of that's finished, right? Now, your prognosis, once you have a diagnosis, especially if it's something like cancer, don't you want to know what's going to happen next? Don't you want to know what the odds are? Like, when am I going to get better? So a classic example is breast cancer. Everyone loves going, oh, I'm a breast cancer survivor. Then I ask, when's the last time you were diagnosed? Oh, 2-3 years ago. I don't want to tell them the odds of you getting it again are pretty darn good, because the prognosis is not good until it's 10 years after. So you can get it in 5 years, you can get it in 6 years, but that's what the textbook says. I'm in a state and condition of before knowledge. I'm making an educated prediction. It may come true, it may not come true. But if you don't listen to the management, odds are you're going to get whatever you're going to get. Like, for example, first line heart attacks, right? It's totally salvageable if the patient listens to the diet and does everything to do the meds, does the physical therapy. The prognosis for your heart attack, especially around the age of 35 to 45, is very good. But what do most patients do? Most patients don't listen. So the prognosis will be poor, right? So, but again, I can't predict if you're going to live or die, but because the odds are, based on statistics, based on what we already know of the disease, this is most likely going to happen to you. For example, you have skin cancer, your prognosis is pretty good. You most likely will live. But if you have, what's a horrible cancer?
Pancreatic.
Yeah, pancreatic. Oh, thank you. That's a nasty one. If you have pancreatic carcinoma, prognosis is 3 to 4 months, if you're lucky, right? And I can tell you right now, statistically, I've had about 6 or 7 patients in my short medical career. All of them died in less than 3, and all of them died very, very hard. Uh, and it's one of those, it's just, majority of cancers we can deal with, but pancreatic CA and pancreatitis is just one of those things that medical science is still has yet to go attack, and it's relatively rare, so there's not a lot of funding that's going to go into it. ETT, endotracheal tube. We call it ET tube, but you could call it ETT, but I've never seen it. I always see it like ET and then the word tube. Endotracheal. I put a tube in your trachea within your trachea, right? And that's when I intubate you. I put it, down your throat. Forced vital capacity, nice to know. Bicarbonate, nice to know. We'll talk more about that in anatomy and physiology and in your chemistry classes. EEG, now that looks really close to EKG, but it isn't. EEG is your electroencephalography or electroencephalogram. So if you look at, it's almost like the EKG, but look at the root word. Encephalo means brain. So this is what we do when we do a sleep study, or if you're suspected of seizures or suspected of any electrical brain problems. We put these electrodes on your brain and then we monitor you that way. Heart failure, yeah, that's serious. CHF, maybe you'll see that, congestive heart failure. That means, now remember, your heart and your lungs are cousins. If one fails, the other one will fail. So for example, it's called cor pulmonale or right-sided heart failure, CHF, or right-sided CHF, and that's called cor pulmonale. That's when lung pathology caused by right-sided heart failure. The right side of your heart is intrinsically connected to your lungs. So when your right side of your lung starts failing, it's going to back up pressure into your lungs, and then you're going to have like pneumonia-like symptoms and severe bronchitis-like symptoms. That's a hard way to die. NMT, nebulized mistreatment. I don't see that too much. MRI, magnetic resonance imaging. We like using an MRI for soft tissues, blood. We like using MRIs for neurologic things. Oxygen, of course. Obstructive sleep apnea. I've never called it OSA. PCO2, PaCO2, PCO2. Now, P means partial pressure. So CO2, of course, is carbon dioxide. But if you see this little A next to it, that means partial pressure of the arterial side of the business. Remember, you have arteries and then you have veins. So the arterial side is your PaCO2, and PCO2 is your overall pressure of carbon dioxide. PCP, pneumocystis carinii pneumonia. I already mentioned that. PE, yeah, sometimes they call PE pulmonary embolism, but PE usually means physical examination. Pulmonary function test, PFT, that's common. pH is if your blood is acidic or basic, and we'll go over that in greater detail when you're in anatomy and physiology. Polysomnography, I never saw it called the PSG, but when you look at the word, right? Somno means sleep. Graphy is the process of recording. Poly means many. So process of recording, many, sleep, or many aspects of your sleep. And one of the ways we do a sleep study is you go to the clinic or the area the hospital, get a nice room, listen to sounds, and then we hook up an EEG to you. SAT or O2 SAT means O2 saturation or oxygen saturation. How much oxygen is in your blood, right? And I already mentioned your O2 SAT should be at least 97% or higher. And that's the O2 SAT. That's the little, that little thing that they put on your finger when they monitor your heart and when they put you in the hospital. Now, SIDS, that's ugly stuff. Sudden infant death syndrome. And it's usually cardiovascular for whatever reason. And it's usually a mystery, and there are predispositions for it, but mostly genetic. SIDS is when the infant, either heart or lungs, stop. And the most dangerous part is within the first 8 weeks of life. I think with each and every one of my children, um, I didn't sleep the first month. I always was had just one eye looking at them. And babies, for those of you who have children, have natural apnea. If you ever watch a baby breathe, especially when they sleep, there's moments where they don't breathe for like a long time, like 4 or 5 seconds. And as a parent, it's kind of scary, but it's part of the natural cycle on how the baby's brain learns how to breathe. SOB is shortness of breath, also known as dyspnea. And of course, TB is tuberculosis. It's caused by the Mycobacterium tuberculosis. I don't know about you, gang. All this COVID stuff flying around. I'm more concerned about TB than COVID. TB is way more infectious than COVID, and TB is one of those things. It'll take out a lot of people, and it'll take out a lot of people fast. And tuberculosis is rampant in the developing world, especially in Southeast Asia, where I am from. And actually, I was part of the World Health Organization's about 20 years ago. A whole bunch of medical students got together all over the world and started this group, which changed into the International TB Foundation. But we called it, back then in the mid 90s, we called it SWAT, Students Working Against TB, because man, I'm from the Philippines. We have extra special TB there that you have to take 4 different medications for at least a year. And that's also all of your contacts. That means everybody in the house and including your neighbors have to take those meds. And that's some serious stuff. Now, everything else, nice to know, especially the pathologies. You'll get into more of that in anatomy and physiology, and also you'll get into that in your pathology class for those of you who are going to move on to nursing. Now, with that said, are there any questions, comments, or recipes regarding this particular chapter and what we just went over? And kindly unmute or put your question in the what's a who's in the
So,
part. Yes, go.
yes, I just wish to know, do we need to know all these abbreviations
Yes,
for both exams?
yes, because abbreviations, I randomly ask abbreviations, and also you could sit and wonder what's going to be an exam, what's not going to be an exam, but you also have to ask yourself, once I get working in the real world, don't you think everyone's going to be using abbreviations, and you're going to be the only one who doesn't know anything? So I look at education like this. Yeah, sure, if it's going to be on the exam, so what, right? I'm going to study it anyway, but you got to ask yourself, I need to know this for being out there, right? Because that's the important part. And I'm one of those people who I really wouldn't care less about grades. I went to medical school. Everyone was magna cum laude, summa cum laude, but not everyone made it. Everyone had all these grades, all this money, and then when we all got out, right? Those of you who've been to a hospital, anyone been to a teaching hospital in the middle of May? Ever watch a new resident? They know squat, because it is the moment where they realize all the textbook stuff is related to something in the real life. Now, on a practical answer to your question, am I going to be asking tons and tons of abbreviations? Think about it. If it's only 50 to 60 questions for a midterm, right? And then by the time you get to the midterm, you should have like 4 or 5 chapters. So in a chapter, there'll be like, could you discover 10 or 12 high value questions that would come out? And would a lot of this come out? Yeah, maybe, maybe not. But as a direct question, it wouldn't. But as an indirect question, it might. So yes, it's in, but would I study just these? No. I would study them within the context of course, the main words that we all talked about. I hope that answers your question. And then a nice little hint on,
Yes, sir.
now the test on Zoom, it'll be, of course, the same exact exam or same version of the exam. And it will, this is how the Zoom is going to go down for those of you who can't make it to campus. You'll log into Zoom, okay? You will have your camera on and you will be facing the camera the entire hour. I will be randomly monitoring because if you're looking at another screen, guess what happens to your eyeballs? You start looking at other things. Now, here's my thing. If y'all want to cheat, be my guest. This is a 100 level class. And if you're cheating on a 100 level class, honestly, quit. You don't belong here, right? You quit on any class, you cheat on any class. You don't belong here. You will be found out. And go, just last term, we let 2 nurse candidates go. One of them for cheating, and one of them, she quit because we found that all her papers were written by somebody else.
Wow.
Yeah, wow. So if you can't be honest on a 50-item quiz, how can you be honest when you're dealing with patients and people's lives? And by the way, my nursing counterparts, they're not like me. I'm a sweetheart. Your nursing professors are sticklers for the rules, sticklers for due dates, and they'll tell you outright, they don't want to hear the story about your family. They don't want to hear your sob story. Something's due, it's due when it's due, right? So, and why do we have to be hard on you? Because I can tell you, if you're in my ward, I'll just get you fired if you don't belong, because you're endangering not only my patient's life, you're endangering the careers of hardworking people around you. And so we all now know that now what? We're now playing in the big leagues now. This is the board of nursing that we have to answer to. So yeah, it'll be 50 items, but when you come to think about it, can each and every one of us pick 10 to 15 high valued words each chapter? Yeah, you could start seeing from my lecture which words are. Does everyone start to notice which words keep on coming out? Like, how many times did I talk about diagnosis, prognosis? How many times did I talk about the word EKG or EEG? How many times did I talk about the word bronchoscopy versus bronchoscope, right? There's certain things that start to come out, right? And there are certain words that keep on repeating itself. Oh, by the way, I always tell this joke. If you get any word with logi or itis wrong, just call it a day. Because how many times I mentioned logi, study of, how many times did I mention itis, inflammation of? So if you miss a logi or itis, I don't know what to do for you. Just call it a day. But I don't think anyone's going to miss it if everyone looks at the practice quiz I'm going to put out, and if everyone looks at, does the quizzes and does everything diligently. I think you should be fine. Someone else?
Sir.
Yes, shoot.
Yeah, this is Vera. I have a question in relation to the abbreviation discussion board. Number 2.
Yeah.
I realized that for something you made some correction. So what we did is not pertaining to what you're requesting for.
Well, what do you? Wait a minute. Now I'm confused. What are you asking about? The assignment?
This is in relation to the discussion board number 2. Yes.
Okay, so discussion 2. Let's go to discussion 2. So we can all see, because when I always let
you wanted it in a particular format.
So when we look at where's my post? Week 2, discussion 2. We use abbreviations in many aspects of medical practice. JCO, of course, the commission frowns on the use of the use and potential misuse of abbreviations. Right? Just like the first week. Do you think it's a good thing or a bad thing? Pick a side and defend it. So the format will be, you have your distinct beginning, middle, and end. An introduction, right? You could add what's JCO, what are these potential bad abbreviations. You could talk about that. And then you have a body that will have evidence that's saying, is it a good thing or a bad thing? And then defend it. And then, of course, utilize APA formatted citations and legitimate sources such as .gov, .edu, and .org. That's the format of what you should be answering. Okay? Did I answer your question?
Okay. Other than that, we have to redo it, or what is the way
Now,
forward?
if I had a comment to you that, hey, your citation is wrong, just redo the citation, right? So that you can get full credit. Because if your citation's off, that's like -10. If your citation is off and doesn't pertain to, like, there's some people who like just put a citation for the heck of it, and it doesn't pertain to what's inside the paragraph that you wrote, that's another 10% off. And when I answer you, I usually put like a comment. I reply to this. Ooh, I forgot to reply to Miss Lewis. But if Miss Lewis is looking, this one looked okay to me.
Okay.
So if you have a little comment like that, and usually it's usually something, it's 9 times out of 10, it's usually a citation issue. All right, watch that video that I put up. It makes it really easier for you, so you're not, not spending a chunk of your time doing citation work.
So for the
Alrighty?
midterm exam, is it multiple choices?
Yes, as stated before, and also in the announcements, the midterm and the final is 50 to 60 questions, multiple choice format.
Okay.
That's
Thank
what
you,
the
sir.
exam. All right, the topic for week 3 discussion. Yeah, I'm gonna put one in when you guys sign off. I haven't decided which one I'm gonna do yet, but it's gonna be just like this. It's gonna be something simple.
All right. Thank you.
Anybody else?
Dr. Garais, this is Agnes. I'm just joining the class for the first time, so
Okay.
I'm trying to figure out, how to go about the assignments and.
Well, like we discussed before, since you were like registered crazy late, I'll give you, you and I could talk offline, and I'll give you like all the time. And also, if you sign up for another tutoring session, we can walk through it together.
Okay, thank you.
Okay. Anybody else? But Miss Ajayi, welcome, and thanks for catching up and getting in.
Thank you.
Doctor, this is Roxana.
Yes, Miss Roxana.
I didn't see when you posted the discussion number 2.
Yeah, and if you look at it, did I put it in it? I wrote, since I posted it late, I'll give anyone an extension to anyone who asks. So if you want to post it, I won't put, if you want to do it today, tomorrow, or in the next couple of days, I'm cool with it. I won't take any points off.
Thank you so much.
Because it was my bad. I thought I put it in. I put it, stupid me, I put it in another class. And my other class was like, what's this crazy discussion? It sounds like medical terminology. And I'm like,
Yeah, because I checked.
and then I looked and I'm like, oh, oopsies.
I checked on Friday and there was nothing there. It just said to TBD.
Well, when you see something like that, don't leave it alone. Please call me. The first wind I got, there was nothing there. It was already, look at it. It was already like Friday night. All right. Which means what? Why are you guys looking at your discussions at Friday night? I should have got something Monday night or Tuesday morning. Like, hey, Dr. Garais, you didn't put it in. But I'll put in the one for week 3 shortly, right after we log off here.
Okay.
All righty. Thanks for being diligent and watching out.
All right.
Anyone else?